This is my video on wound dressing changes. I have already verified my doctor's order. I've cleaned my bedside table. I've administered pain medication if need be. Gathered all my supplies. I enter the patient's room, introduce myself, ask for 2 patient identifiers, last name and date of birth, as well as check the name wristband. I'll explain that we're doing a wound dressing change today, and if there will be anybody at home to help them with their wound dressing change, so that they can be present as well for the education. I will ask them if they're ready to begin. So in this case, Stella is ready to begin. I'll perform hand hygiene and apply gloves. I got a defective glove. I would raise the bed to proper working height, and then I would expose the patient just in the area that I would be working in. I would take an alcohol swab, and I would swab the borders of the dressing to help remove it, remove the tape, and I would throw that in my biohazard bag. I would remove the dressing, and I would note the drainage on the dressing, any odor, and how much is saturated. So in this case, this 5x8 pad is 75% saturated with sanguineous discharge. I would dispose of that in my biohazard bag. And I would measure, if appropriate, the size of the wound, length, width, and depth as appropriate. I would measure in centimeters. Okay. I can throw that in my trash, and I will throw out my gloves. Perform hand hygiene again, and apply new gloves. I will then cleanse the wound. And as I'm doing this, I can be talking to the patient, explaining to them what to look for at their wound change, what the signs and symptoms of infection are, and where they can purchase supplies at. So I'm going to saturate my gauze pad with wound cleaner, and I will clean the wound starting from the inside and working my way out. I've noted that this wound here is well approximated and has 6 sutures present, so I want to be careful of that while I'm cleansing the wound. If the wound was truly bloody like the pad indicated, I would use several gauze pads and wound cleanser to clean the area efficiently. I would then take a dry gauze pad, dry the area, and throw that in my bag. I remove my gloves, perform hand hygiene again, put on a new set of gloves, and apply the new dressing. I would tape each 4 borders of the dressing as appropriate, cover the patient back up, lower the bed for safety, ensure that they have their call light, ask if they have any questions, and then I will exit the room to document.